Right behind me is a gathering of major players in the health sector and the media deliberating on the rising trend of malnutrition in the country. Today on Soundhealth, our focus is on scaling up nutrition across the country. I'm Olasunbo Modupe. Welcome to the show. On innovation this week, researchers showcase the use of 3D augmentation reality and visualization for surgery. That's in a moment. Please stay with us.
Nutrient deficiencies delay mental development in infants, reducing their ability to learn in later life with a knock-on effect on school performance. According to the 2016 Food Sustainability Index, Nigeria is ranked second last out of 25 countries, below Ethiopia and Indonesia, for the nutritional health of its population. 1/3 of Nigerian children under 5 are stunted, meaning they suffer reduced physical growth due to inadequate nutrition. Additionally, screening data collected by NGOs and United Nations Children's Fund, UNICEF-supported teams in Yobe and Borno states included assessments of IDPs with the proportion of children with global acute malnutrition reported to be over 80%. These initial assessments provide an indication of increasing levels of acute malnutrition.
They need to fund maternal nutrition, which includes counseling. If you go to our medical center where the women are supposed to be well educated, because, for example, they get money from some organization that promote, for example, baby milk, doctors or nurses or caregivers don't remember to tell, their patients that exclusive breastfeeding is the best way to go.
But the truth of the matter is this, that there are so many variables in this country that contribute to this mortality. Malaria is a big one, diarrhea and so on, also complication. But like it was pointed out in the presentation, most of these have a basis in malnutrition. In other words, children who are properly malnourished are not likely to die of these conditions. But critically, it's the nutrition that is bothering us. That people are not getting enough to eat and they're not getting the right quality of food to eat, particularly the children.
Welcome back. It's still Soundhealth on Lagos Television. Joining me now to take the discussion further on acute malnutrition is no other person than the National Coordinator of the Media Center Against Malnutrition, Remy Weke. Welcome to the program.
Thank you so much for having me.
Okay. According to a recent study by UNICEF, about 2.4 million Nigerian children are malnourished. This is about half the population in the northeast. How did we get here?
We started looking at how we'll get there. You can't take it away from poor information management. You can't take it away from lack of political will. You can't take it away from commitment from the leaders. So when you put all these three together, it's called that there has been some loopholes, and we need to start closing those loopholes for us to make headway. And that was one of the reasons why Media Against Child Malnutrition actually came up. In one of our session training, we discovered that it's a very huge issue, unreported issues. And we felt that we needed to do something beyond just reporting it. So we came up with the advocacy group to drum more support for the children precisely, and then promote in terms of scaling nutrition generally in Nigeria.
It is even more worrisome when the statistics is bound to increase later in the year.
That's true. But we are not going to be pessimistic about it. I agree that it's statistically correct, but we all have to put our hands on the deck to make sure these things are changed for good. Because like you may know, if once we have stunted children, it affects their future. Even if they scale the era or the period of death and survives it, their future is one way or the other affected, including their IQ, their understanding, how to understand things and then cope with life and things like that. So it still affects them. So you may not expect maximum human capacity from such children. And if you are unlucky, you now find them in leadership positions without them knowing why they are there. So it becomes another dual problem for society.
Looking at the statistics, the most affected are under age 2. And how can this be when we have mothers breastfeeding? Mothers are expected to breastfeed their babies, newborn babies, within 2 years.
Yes. Yeah, that's true. But the other side of it is that most of our mothers, or say young mothers, don't even understand why they're breastfeeding. Some give you all manner of excuses, either from what they have heard, from wrong information really, that maybe if they breastfeed their child or breastfeed their child, that they are going to lose their physical composition, within a short time. All these things are myths. Okay? It does not hold waters because everything happens by age. Okay? There is time for everything. And the good aspect of it is that if you breastfeed a child, that child is like you are giving him first immunization. So he fights against every unnecessary odd illnesses that could come around. It's not every illness that comes around town, your child will get it. It's like first immunization. Yeah, empowering that child with that first immunization to the world. So from that moment, you have done a very good job. But if you start looking at it from your own personal perspective, the child will suffer later on in life. And you think, you may not gain because eventually you'll be the one carrying the child around, going to hospital. That is, if you don't start blaming one.
Okay, general consensus is that acute malnutrition, the condition is restricted to just the poor. How true is this?
It's not true entirely. The poor have their own challenges. Even the rich have their own challenges because at times they eat the wrong food. By me eating the wrong food, you are automatically going down the path of malnutrition. Okay? But when you are eating the right food, it helps in solving the problem of health. That's why if you look very deeply, you discover that most children from rich homes are the ones suffering obesity and all whatnot because of the kind of food they take. So those food intake matters a lot too.
Moving away from the general consensus now, as little as 1,500 naira is needed to prevent malnutrition in children, while about 25,000 naira will treat a malnourished child. With the recessed economy, is this achievable?
It's achievable if you work on it. It depends on the priority of the government and of the people, really. Because the people can force the government to do what they want. Okay? And that's why, and more reason why, we are asking for more support to continue advocating for our society to buy in, especially professionals who are supposed to be in the know. Because if you don't know, especially media practitioners, you may end up confusing people, may end up carrying or even endorsing fake news. All right? But if you know, when fake news comes up, you should be able to say, no, this is not the right information. All right? And then educate those who may be around you or who may be listening to you or reading you with the right information. But if you are not informed, you end up either buying it or even worsening the situation by escalating the same fake information or fake news. So you end up not helping the society to get better.
How can nutrition be scaled up among the children? Because the condition is not just about the Northeast, the internally displaced persons. It's across the board.
Yeah, yeah.
How can we move from this present status in the country?
Yeah, how we can actually do that is, like I've mentioned severally, we have to do with providing the right information. We need to have the right information from the experts. The media professionals need to project the same right information. And when we project it through radio, television, print, and even online, that people now go more often these days, we should be able to project these things across board so that whichever one that comes to Nigerians or populace, they will have the right information at their fingertips.
Okay.
So with a younger generation now having to know that breastfeeding is the first immunization I'm going to give my child, we will not see it as a societal thing. We will see it as a societal commitment that must happen for me to be happy in life, and then my child also to be happy moving on.
Okay. To enlighten a nursing mother now, or if you're to enlighten a group of mothers now, what's the way to go?
Well, first of all, it depends on the medium that's available to the mother. But I know these days, almost everybody is on social media, all right? So the best thing actually is to keep the message simple, so that people can understand it. Even if it is a second, primary 6 people, to be able to understand the message of nutrition or malnutrition, as the case may be.
So what is the role of the media in all of this? Why the media and not the government or other major players?
Media plays a very important role in every society, and that's why it's called fourth estate, because we mold opinions. We many a times make society what it has to become. So it's important that media do a buy-in. So, and with media buy-in, we scale up the level of information we are passing to our populace. But then we must equip ourselves with the relevant information, build our own capacity, and with that, can now face the world, face our own world by giving them the right information at all times.
So what are some of the resolutions or communique expected at this forum at the end of the day?
We may be proposing is to develop a national strategic plan for advocacy that will be developed, cutting across all the media. It will help all of us in running the campaign, passing on the information, knowing where to get the experts, and then how to deliver the information that is available to us. And then we'll send it to all the relevant government agencies, the ministries, including the Ministry of Information that covers media, and then health as well, because all of us are in this campaign together. And then the civil society need to also, we must involve all of them, both locally and internationally, and those who are supporting us too.
Thank you so much for sharing your expertise with us on Sound Health.
Thanks. I appreciate it. Continue your good work.
Welcome back. It's still Sound Health, and I'm Olasunbo Modupe. On innovation this week, researchers showcase the use of 3D augmented reality for surgery. Please stay with us. The program continues.
.3D visualization and augmented reality for surgery.
Surgeons have relied on microscope oculars or other camera systems to operate. However, surgeons also typically depend on their own eyes and interpretations to execute the most precise tasks. Two of the most intricate surgical practices, neurosurgery and retinal microsurgery, have been experimenting with new technology in the past year. These stereoscopic systems not only keep a surgeon's head up, but it immerses the surgeon into a high-resolution 3D visual representation of their subject. Experts and surgeons that have piloted the new systems believe the added comfort and visual information will allow surgeries to operate more efficiently and effectively. A growing number of hospitals will be adopting these new systems in 2017, pushing the boundaries of surgical reality as we know it.
Remember, malnutrition has become a major silent crisis in Nigeria, but with collective efforts, we can end this rising trend. That's Sound Health today. Hope you've learned a few things. For comments and inquiries, please send SMS on 0818-815-3695 or follow us on social media at LTV Social, #SoundHealth. It's Sound Health. It's a sound mind. Make healthy living your choice.